Welcome everybody to today's Doctor's Day Grand Rounds. We're so thrilled that you've joined us. Today's subject is sleep, a powerful elixir for physician well-being. And we are offering CE today. So I just want to do a few housekeeping things as we usually do. We are recording this session so it can be archived and you can see it later. In the chat room, you should be seeing the events and programs link that you can see this at a later time. We will have questions and comments after the presentation at the end, so we really welcome you to unmute at those times or type your questions into the chat for our facilitators. Please sign in for your attendance to claim any CME or CE through EEDS. I will be showing you the code in just a second. Make sure after you've completed this program that you sign back in to fill out the evaluation so that you actually get your CME to receive your certificate. We also send out our own evaluation. We really appreciate if you would take just a minute to fill it out so that we can make these programs better for you. Everything should be in your chat. So right now you should be seeing the actual sign in for the chat. I'm sorry, for the program so that you can sign in for your CEs. Today we are offering one CME. Oops, I'm so sorry. It says 0.5 credit. It should be 1.0. Apologies for that. Peter Kim and Gail Gazelle are our doctors today who are presenting, and they have no relevant financial relationships to report in the last 12 months with a commercial interest. This activity is not commercially supported. Again, we will be offering one AMA CME today, so sorry for that little mistake that you see on the screen there. Okay, coming up next week, we are going to be continuing with Dr. Gail Gazelle. Strengths, not stress, is next Wednesday's program. Shifting from what's not going well and what you haven't accomplished to what you have. And then join us again the following Wednesday for Don't Run on Empty, Understand How to Fill Your Tank. We're looking forward to both of those. And we have a special gift today. Dr. Gazelle is giving away 2 spots in her workshop, Imposter No More, Saturday, April 17th, 10 a.m. to 12 p.m. I'm sure all of you have felt as an imposter at times in your life. Well, you know, people think I know what I'm doing, but I'm not sure I do. It's a great program. We've heard something like it previously. If you are able to join us Saturday, April 17th from 10 a.m. to 12 p.m. and you're free, please put your name in the chat and your email address, and we will have a raffle at the end of the program. So stay tuned to the end of the program to get both your CE and know if you're the raffle winner. So let's get on with the show. Today's program, sleep, powerful elixir for physician well-being. Our learning objectives are to help physicians and clinicians recognize the importance of sleep to their well-being, encourage all of you to realize that disrupted sleep is associated with poor work satisfaction, burnout, and increased self-reported medical errors. And we're going to explain what mindfulness and understanding how mindfulness can really actually improve your sleep. So I'm going to turn it over to Dr. Peter Kim, one of our PAGNI physicians. He's a general trauma and acute care surgeon at New York City Health and Hospitals Jacobi and at North Central Bronx. He's an associate professor of surgery at the Albert Einstein College of Medicine. He's the treasurer of the PAGNI Health of Directors, and he's the co-author of Assessment of Physician Sleep and Wellness, Burnout, and Clinically Significant Medical Errors that was published in JAMA Network Open just late last year. Take it away, Dr. Kim.
Thank you very much for that great introduction. I was testing out our PAGNI Doctor's Day gift, which are wireless music goggles that everyone should get from their administrator. Thank you very much. So happy National Doctor's Day. Go back to that slide. I learned how to use the internet this weekend and found this website called Wikipedia that described the first Doctor's Day was celebrated in 1933 to recognize the anniversary of the first use of anesthesia for surgery, actually, in 1842. And President Bush signed it into a resolution in 1990 that we should say March 30th should be Doctor's Day. This is celebrated all over the world. We used to honor all the physicians who care for us, and we should remember those physicians who've passed away in the last year, especially after dedicating their lives to medicine. Next slide. We at the Physicians Affiliate Group of New York are very lucky to have an excellent executive team, and we're sad because Dr. Luis Marcos, who has been our CEO, our intrepid leader for the past 10 years, is retiring. And tomorrow will be his last day. And he's done a great job for us, along with the rest of the team, Jorge Montalvo, Anthony Medina, Diana Voigt, Carlene Evans, Reggie Odom. And I give a special thanks to Tahino D. O'Connor for helping me learn how to use PowerPoint for this presentation. Next slide, please. So why is sleep important? Well, if something, I've been doing this all my life, sleeping, not very well. But if it's been maintained across 500 million years of evolution, we're learning that it has some critical functions to our survival, as well as basic science, cellular, metabolic housekeeping. Impairment in sleep is maybe associated with diabetes, as well as while we're sleeping, we're clearing unwanted waste products from the brain, maybe molecules like beta amyloid that we know is associated with Alzheimer's dementia. More and importantly for us, sleep deprivation leads to emotional dysregulation. No surprise. And what's important is that poor sleep can decrease physicians' capacity for empathy, and interpersonal engagement we know is very important to be an excellent physician. Next slide, please. I was lucky enough to be part of a research project with PAGNI, where we looked at a survey of physicians throughout the country to assess physician sleep and wellness and see if there was an association with burnout and clinically significant medical errors. And this was led by Mickey Trokel and Tate Shanafelt. And it was published early last year in JAMA Network Open. So we'll go through that, that study that we were lucky to be a part of as PAGNI. Next slide. So this was data from the Physician Wellness Academic Consortium that was collected, thankfully, from the New York City Community Trust. We were also able to get financially supported to have focus groups to address the results of this study. So it was 11 academic institutions, multi-center throughout the country, including Stanford, where this is based, the consortium, the Brigham Hospital at Harvard, MedStar in Washington, D.C., and more than 700 of our own PAGNI physicians actually contributed to this survey that was done between November 2016 and October 2018. 40% of the attending physicians responded, and more than half of the house staff responded to the study. And there was an equal division between men and women responding to the study. Next slide. And here are the results. So sleep-related impairment is associated with, number 1, interpersonal disengagement. Number 2, work exhaustion. Number 3, overall burnout. And sleep impairment has a negative effect on professional fulfillment. So that was what we found through this survey. Next slide, please. This is a slide from the paper that shows that moderate, high, and very high levels of disrupted sleep correlated with increased odds of self-reported clinically significant medical errors. Interestingly, in this multivariate model, if you look at the trainees, if they have burnout and sleep-related impairment, they were much more likely to respond that they had a self-reported medical error within the past year that seemed to have harmed some of the patients. So I was very happy to be on call this weekend and see that even though I was doing a 24-hour shift, the residents were doing 12-hour shifts. I think that's good for them and their future. Next slide. So from the paper, this is our conclusion that long work hours leads to sleep-related impairment, as well as decreased performance. And when you have decreased performance and efficiency, that leads to longer work hours, finishing things like electronic medical record. So this is a cycle of poor sleep that we can really address, we hope, both at the personal and the systems level. Next slide. So I went to Barnes & Noble, to the magazine stand, to get some answers. And this was a title of a whole magazine I found, Sleep Better Now, dedicated to how to get better sleep. Next slide. I also found another magazine, Consumer Reports, had the same title, Sleep Better Now. So this seems to be a hot topic that actually in March is Sleep Awareness Month nationally. So I wanted to tell a story about how I had a classmate from Harvard who also went to medical school a couple years after I did. And in his first year, he said, I'm just not sleeping very well. My mattress is so uncomfortable. And I said, listen, sleep's really important. You got to get a new mattress. So they have a list of about 80 mattresses in this issue. And after he graduated, I saw him at a reunion. He said, that's the best advice I ever got as a medical student, was to get a better mattress. Next slide. So we're told physicians heal thyself. So we got to prioritize sleeping. Get a primary care physician. And if you're not feeling well, seek help. Sometimes we think we're super people and we can do anything ourselves and fix it. But I think these programs we're having here through PAGNI have helped a lot of people. And that's the kind of thing that we should do, is help each other. Next slide. But that being said, it's already been 20 years since the Institute of Medicine published Error is Human. And we found that physician errors may not be due to the individual doctor. It's not because we're bad doctors. There are problems within the system that should be addressed and can and should be addressed. And we look at the Swiss cheese model of how bad things happen. So from our paper, we made some suggestions that we should consider limiting the length and frequency of extended shifts. We should decrease the number of successive night shifts or on-call nights, maybe even mandate rest breaks during long shifts. So I'll take a nap after this presentation. And then we should avoid scheduling 24-hour shifts. As I said, my residents are doing 12-hour shifts now on the weekends, and I think that's great for them. And as the largest and we think the best physician group in New York City, we should hire and retain more physicians. We've been very successful doing that, and by having more people to take care of the patients, hopefully we can avoid burnout. Interestingly, if anyone has an idea, we really need you to come up with ideas. Please include that in the chat, so at the end we can use that for discussion. We think everyone can contribute to have a good idea. Next slide, please. Best thing, if you're able to sleep, then you're able to move on and have dreams. This is a painting by Pablo Picasso, Le Rêve, which means the dream. Next slide. And so I'd like to thank PAGNI for allowing me to talk to you today. I want to introduce my partner in this session, and Dr. Gail Gazelle is a world-renowned assistant professor from Harvard Medical School. She's a master certified coach who's been helping our PAGNI physicians with their careers during this past year. She is also the author of a book that came out in 2020, Everyday Resilience, a practical guide to build inner strength and weathers life challenges. It's my honor to introduce Dr. Gail Gazelle.
Thank you so much for having me here. And it's really a pleasure. And I want to echo Dr. Kim's really saying happy Doctor's Day to all of you. And really happy Healthcare Day to everybody in healthcare, in PAGNI, and whatever capacity you work in who are joining us today. And I want to kind of pick up where Dr. Kim left off. And what I want to do in my time is talk a little bit, kind of an overview. Why do we have so much difficulty with sleep? I'd like to then talk about mindfulness and how mindfulness can be helpful. And then I will lead you in a brief exercise. And that will leave us at least 10 minutes or so for questions at the end. If we could go to the next slide. So we understand, as Dr. Kim and his study really help us see, the incredible kind of burden of impaired sleep, as he talked about, on a cellular level, on a psychological level, on a physical level. And so many of you in the audience are aware of that because many of us suffer from chronic insomnia. It's estimated that this affects 30 to 60% of adults and an even higher percentage of older adults in North America. The cost to the average US worker is 11.3 days of missed work, or approximately $2,280 in lost productivity per worker per year. And as a nation, the total cost is estimated to be very high. You can see here, 63 billion. And the sleep industry, and I think this is an underestimate, is in the $30 billion a year market in the US alone. And this comes to us from the American Academy of Sleep Medicine. And what are all these dollars going into? Well, they're going into sleep aids, mattresses, pillows, pharmacologic interventions, programs to improve sleep, a myriad of things that, again, I suspect that some of you are familiar with. Now, if we go to the next slide, the question I think really becomes, with all of this monetary output and all the efforts that are made to improve our sleep, why is it that many of us still struggle with our sleep? And what I want to get at in today's session is that at least part of the problem is the workings of our own mind. So let me walk through this pictorial here. For a variety of reasons, we can be sleeping, and then our sleep cycle can be disrupted with some type of arousal. So the myriad of medical issues that can disrupt our sleep, from hyperthyroidism to lupus to so many others. Our sleep can be disrupted by physical pain, discomfort. It can also be disrupted by emotions. Something may be emotionally valent in one of our dreams, for example. And very importantly, our sleep can be disrupted by thought and by rumination. That sets in motion a cycle whereby the body is lying in the bed, needing sleep, sleep deprived and tired and wanting sleep, and yet the mind is busy. The mind is up, and the mind is reviewing the events of the day. The mind is thinking about what's going to happen tomorrow. The mind is worrying about projects, about finances, about COVID, about family members, around a myriad of things that our minds can get caught up in. And we can lie in the bed, again, wanting to go back to sleep, but our mind is busy, busy, busy. And in addition to all those places where the mind gets stuck, the mind further can take us to, oh no, I'm not sleeping. How will I manage tomorrow? Oh, this is going to be a bad night. I'm going to be exhausted in the morning, right? Our mind can get caught in a ruminative cycle that actually keeps us more awake and more aroused. That can lead to maladaptive habits. We can spend more time in bed in the morning. We can use things during the day, stimulants, coffee, and others, to improve our wakefulness, which can actually catch up to us when we attempt to go to sleep the next night. And of course, use of sleep aids on a pharmacologic basis, which can actually disrupt our sleep cycle. All of this contributes to the consequences: fatigue, performance difficulties. As Dr. Kim's study demonstrates, profound effects in terms of burnout, and very tragically in terms of our performance for physicians and for others in healthcare in making medical error. And I think it's really important to understand this cycle, that the body is lying in bed, desperately wanting sleep. We all know that state, and yet it is the overactive mind. If we go to the next slide, our minds are a very busy place. In fact, it's estimated that the human mind produces anywhere from 20,000 to 50,000 thoughts a day. And I have to say, as a physician myself, for other physicians, I think we're probably closer to 50 to 75,000 thoughts a day. If you do the math, if you're up for, let's say, 16 or 18 hours of a day, that is an amazing number of thoughts. Now, I don't know if you believe that, if you think that maybe that's the average person and maybe that's not you. So we're going to do an exercise right now to help you see just how busy your mind is. I'm going to time 2 minutes, 120 seconds, and your task in that 120 seconds is actually to count how many thoughts you have. So I want you to imagine that you're almost like a cat outside of a mouse hole, kind of ready to pounce anytime a thought comes into your mind. You can take a pen and kind of make a tally, 1 thought, 2 thoughts, more thoughts. And at the end of the 2 minutes, we're going to do this poll. So you can just put the poll aside for a moment, and it will have 2 minutes of quiet. It might feel like a lot longer, but we will start now. That's 30 seconds. That's 60 seconds. That's 90 seconds. That's 120 seconds. So if you'd be kind enough to enter the number into the poll, A is 1 thought, B is 2 to 5 thoughts, C, 6 to 10 thoughts, and D, too many thoughts to count. So please take a moment to enter your number. And if you can show the results. Okay, wonderful. So nobody had 1 thought. We see that 10% of you had 2 to 5 thoughts, 41% 6 to 10, and a whopping almost 50% of you had too many thoughts to count. So you can close the poll. Thank you, everyone. So I think you begin to see just how busy our minds are. And many of our thoughts are tremendously useful. Get out of bed, brush your teeth, move out of the way of that truck. This is a diagnosis of Lyme disease. But what we begin to realize with mindfulness is that actually many of our thoughts are not so helpful. They're judgments, worries, fears, planning, rehearsals, all kinds of things going on in our mind that can actually contribute to wear and tear during the day and insomnia during the night. Next slide, please. So I want to transition, next slide. If we think about what mindfulness is a type of awareness, and it's the awareness that emerges when we pay attention on purpose in the present moment with less judgment than we typically bring. And as this says, non-judgmental awareness to the moment by moment unfolding of our experience. In other words, we're paying attention to the present moment, the moment that's here right now, not what went on 3 hours ago, and not what's going to go on tomorrow in a future that we can never 100% predict. And what's important about mindfulness, I think many people are aware that mindfulness can build calm. That's what the practice of meditation is often billed as doing. But it really can do so much more. When we pay attention, we step out of many of the filters that we have, the cognitive distortions that we all have in how we view ourselves and the world around us, which can lead us back from theories, attitudes, and abstractions to the actual experience itself, and can prevent us from falling prey to our own prejudices, opinions, projections, and expectations. And in doing so, in a sense, we can free ourselves from the straitjacket of unconsciousness. Next slide. And it's important to juxtapose mindfulness with mindlessness. And what is mindlessness? Well, it's autopilot. Many times we go through our day, let's say we get to the end of the day, and it's all a bit of a blur. What did I eat for lunch? Did I even eat lunch? Many of us are on autopilot when we're driving the car. We get to our destination and we think to ourselves, now, how did I get here? And we're not necessarily paying attention to what it is that is happening right in front of us. Another example of autopilot and that lack of awareness in the present moment is when we get home at the end of a busy day and we've had all kinds of difficult patients, difficult administrative issues to keep up, and probably not a lot of time to get everything done. And we get home, we want to be present with our loved ones, and yet our mind is racing. Our body is present, perhaps with a young child or a spouse, and yet our mind is still going over the events of the day, what remains undone, and what awaits us the next day. And so our mind can flit about from past to future, again, rehashing something difficult that occurred in the day, or imagining what tomorrow will bring. And it's not that there's anything wrong with thinking about the past or the future. Mindfulness is about having agency, about deciding, I want to review a past vacation now, or I want to plan what my schedule is going to be like in 2 weeks. When we're mindless, we can feel very stuck and rigid and judgmental. And we can also be emotionally reactive. And again, this pictorial here, the body is always present here in these moments. As long as we're breathing, as long as we're alive, the body is here in the present, and yet the mind is often flitting about. And that is part of the problem of what happens during the night. The body is there, hungry for sleep. The body needs that restorative time for so many important physiologic purposes. And yet often the mind is too busy and the body cannot relax and sleep. Next slide. And so you might be thinking, well, how does mindfulness improve sleep? And mindfulness, in the most important way, it decreases rumination. So I want to just backtrack for a second. When we meditate, we're building our muscle of mindfulness. And with meditation, we're not turning off the mind. We're not banishing thoughts. We wouldn't be successful at that, even if we tried. But we're getting to know the patterns of thinking, and we're training the mind to leave a thought and to come back to the anchor point, typically of our breathing. That's what meditation is all about, training the mind to focus where we want it to focus, which is back here in the present. And in fact, when we're sleeping and the mind is going, what we do with mindfulness is try to bring the mind back into the body. And again, we're going to practice that in just a moment. And if you think about it, what we're doing again with the mind training of mindfulness is we're realizing that thoughts are simply mental events. They're simply synaptic connections that are going on in our mind that we are giving meaning to. We get very caught in our thoughts, but really they are transient mental events firing of a variety of synapses that causes a thought. That thought passes through the mind and then it dissipates because it is simply a transient mental event. It's nothing more than that. And with mindfulness, we're gaining more agency to realize that we don't have to follow every particular thought that we're having. In other words, we wake up at night, something arouses our sleep, perhaps we have to empty our bladder. And then we get back into bed and the mind perhaps settles on a fear. We're in the pandemic. Each of you living and working in New York has seen just, the amazing amount of difficulty, of sickness, of death, so much that can fuel worry and fear and can keep you up at night. Fears about yourself, about your loved ones, about finances, etc. What we're doing with mindfulness is getting to know those mental patterns of fear and helping the mind come back into the body, which is where it belongs during the night. Next slide, please. Now, there are quite a few studies about the use of mindfulness to improve sleep, and I don't want to spend a lot of time on them, but I wanted to just briefly touch on this one study that came out in JAMA Internal Medicine in 2015. And this was an important study. This was a randomized study that looked in two arms. One arm was the mindfulness intervention, which was a 6-week training program in meditation and other mindfulness techniques and strategies. That group was randomized against a more traditional sleep hygiene arm that was also 6 weeks long. It wasn't a large study, but it's one of the more important studies that we have. So there were 25 individuals in each arm of the study. And there were important exclusions around various medical disorders, chronic smoking, mental illnesses, a variety of exclusions to help kind of screen out some of the complicating variables. And they used a self-report of sleep. It's the Pittsburgh Sleep Quality Index, which is a very commonly used index in these type of studies. And what they found after the 6-week paired intervention, again, a mindfulness intervention in one arm, and then the sleep hygiene education protocol in the other arm, was a significant improvement based on the Pittsburgh Sleep Quality assessment that was statistically significant. And if you go to the next slide, I've included this in the references. Again, we don't have the time to get into a lot of the data, but I really wanted you to have the references because there is quite a body of data supporting the importance of mindfulness in improving sleep hygiene and quality. Next slide, please. So before we go on to a practice, I want to just again kind of drill down on how it is that mindfulness improves our sleep. As I've said, something arouses us during the night, a physical stimulus or a mental one, and we awaken, and then our body is lying there wanting to sleep, but our mind is busy. So as I said, what we're doing with mindfulness is we're disengaging from the cognitive stimuli, the thoughts. We're aware that the thoughts are there, but we begin to have a tool to take us out of the thoughts and bring us back into the body. Similarly, we're decreasing the entanglement and the engagement with the emotional stimuli, the fears, the anger, the ruminating about difficulties in our work life, replaying of arguments. Sometimes we can be very emotionally aroused during our sleeps. We can be in a state of limbic activation, which again, I'm sure many of you can relate to. Sometimes we can actually be gripped by fear, can't we? And when we're gripped by fear, again, we're stepping out of the body into the fear response and the secondary thoughts that we have about it. So with mindfulness, we're training the mind to leave that emotional entanglement and again, return to the physical state. So obviously that adds up to shifting awareness from the mind to the body. The body is what we need to attend to during the night. And then very importantly as well, what I mentioned earlier is that when we're having difficulty sleep, our mind kind of gets going about how bad this is. What's going to happen the next day? How will we manage? How will we function? And instead of accepting that we're having difficulty, we're kind of fueling this mental ruminative process as opposed to the relaxation that comes with a little bit more acceptance of, okay, this is what's going on. How can I most effectively work on it? In other words, the ability to kind of nip in the bud this ever kind of increasing ruminative cycle. So I'd like to lead you in an exercise right now. And if you're somewhere that you're safe, if you're not driving or operating any other sort of machinery, I want to just encourage you to get comfortable in your seat. Maybe adjust your posture a little bit so that you're really sitting in a very relaxed manner. And if it feels comfortable to you, to allow your eyes to gently close. And I invite you to take a number of slow, deep breaths. And with each exhalation, see if you can loosen or relax any areas of tightness or tension, allowing the shoulders to relax and drop, softening the low back so that the seat that you're on is holding your weight more firmly, allowing the arms and legs to go limp. Really giving yourself permission to step out of the busyness of your day, permission to step away from all the tasks that remain to be done, to step out of the worries, the concerns, the judgments about the day. And I invite you to see if you can focus on your breathing. Tune your awareness to the movement of air. You may be most aware of the movement of air in the nostrils, or perhaps in the rise and fall of the chest or abdominal wall. See if you can connect with the movement of air wherever you're most aware of it. And see if you can follow the movement of air through one full inhalation, one full exhalation. And your mind may leave the exercise and go off into a thought, a worry, a judgment. Perfectly normal for our minds to do that. When that happens, what's important is just to notice that your mind has left this moment and see if you can gently and kindly shepherd your mind back to following your inhalation and exhalation. Nothing wrong with the mind having thoughts. It's what all of our minds do. What we're doing here is helping the mind to stay focused back in the body, back in the movement of every inhalation and every exhalation, helping the mind return to the body. And perhaps you're aware of one part of your body, the buttocks in the chair, how your neck or forehead feels. And as you're breathing, just see if you can keep your attention on those parts of your body as well. As we come to the end of this exercise, I invite you again to take some slow, deep breaths. And when you're ready, stretch a little bit in your seat and gently open your eyes. So, this exercise that we just did has a name, and the name is meditation. So, for those of you who haven't meditated previously and have wondered what it's about, now you have joined the ranks of people who can meditate and who have meditated. That's what we're doing. And that's something that we can do during the day to build the training of the mind, to stay out of thoughts that are not serving us in any particular moment. And when we do that during the day, we build up this capacity, which can also help us during the night to do exactly the same thing. Next slide. In case it's helpful for you, I've developed a free mini mindfulness course. It's a 14-day course. It's an audio every day. And in less than 10 minutes a day, I provide a talk about a mindfulness subject, and then I guide you in a meditation. And if that can be helpful to you, I think Xiomara is putting the link in the chat. Many people in healthcare have told me they found it extremely effective. And if that can be helpful to you, please download that. Next slide. So thank you so much for your attention. We talked about an overview of what it is that we get hung up in during the night and why it is that this multi-billion-dollar industry doesn't necessarily help us. We talked about mindfulness, what it is and how it can be helpful to you. And then you got a little bit of practice meditating, an important strategy to help us decrease the busyness of our minds. So thank you so much for your attention.
Thank you, both of you, so much good information. This is the time when we announce our raffle winners. If anybody had put their name and their email in, Xiomara, can you let us know who the two winners are?
Absolutely. So I want to give a big congratulations to Dr. Wasim, our first winner, and our second winner, Maninder Singh. You guys have won 2 free spots to Dr. Gazelle's No More Imposter workshop that will be held on the April 17th from 10 a.m. to noon.
Who was the second winner? Did I win? Who was the second winner?
Manager Singh.
You did win.
Dr. Singh, congratulations.
Congratulations.
Okay. So we're going to go on to questions, and we have a few minutes. We've got about 10 minutes, and we would love to hear from audience members. A couple of questions that were prompted by Dr. Kim. How can we think about fixing systemic things in our work environment to help us all sleep better? So that we'd love to hear answers to that. We'd also love to hear any ways that you have for calming yourself down and bringing yourself to a point where you can be mindful, and any tips that you have for sleeping. Dr. Kim, I have a question for you.
Yes.
What is, I'll go ahead and sorry, I'm taking up somebody else's time, but what is it that happens in the brain when really you are deprived of sleep? What is it that can cause you to have make mistakes that you would normally not make? I'm very curious about that.
Well, I do long shifts as a recovering trauma surgeon, I'm aware that the patient care, it's okay. But as I'm leaving the hospital, a lot of times I'm going to my car and I get to my car and I don't have my car keys. And I have to go back and get my car keys. So it's things like that that get difficult. And as I get older, I'm an old man now, I am aware that it takes longer and longer for me to recover. So whereas I used to do 32-hour shift once every couple of weeks, now if I do something like that, it takes several days for me to recover. But being aware of that is important for me to manage my time. So awareness, I think, is really important.
Great, thank you.
Thanks for that question. I had wanted also to thank you and the Pagney Health and Research Foundation for setting up this program to celebrate Doctors' Day. Thanks for the gifts from Pagney. And this program and leadership programs that have been held by the Health and Research Foundation do cost money. And I would encourage everybody to consider donating. Last year I took a large chunk of my own bonus money. We had the best year last year for bonuses for the physicians, and donated that to the Pagney Health and Research Foundation. So we got to keep it going, helping each other. Thank you.
We so appreciate that, Dr. Kim. Thank you for supporting these programs. We love giving them to you, and we hope that they're helping. Any other questions in the chat? Xiomara, do you see anything?
I'll pose a question to the group that might stimulate some discussion. Whether any of you have experience with mindfulness and how you found it helpful, particularly around sleep and sleep hygiene. If you care to put that in the chat, we would love to hear from you.
Great question.
Okay, and I see a question in the chat. How often and how long was the mindfulness intervention that improved sleep in the study? Yes, so this was a 6-week program that involved a 2-hour session in both of the arms. And then there was homework in terms of people meditating, I believe, for 20 minutes, at least 4 or 5 times a week. And I'll just mention, there are a lot of sleep meditations. There are ones that are available on YouTube, for example, or on the app Headspace or the app Calm, all the many apps that are out there. And then there are sleep meditations that are called Yoga Nidra. So these are meditations that actually help the mind come back into the body. They reference kind of lying in the bed, feeling the bedclothes, noticing the sensations in the arms and the legs, all in an effort to bring the mind back into the body. So those are things for participants to try out if that can be helpful to you.
That's great. Dr. Kim, in a previous conversation we had about surgeons and surgeon trainees actually making more medical mistakes. Could you tell the group at large about that?
Yeah, so it's interesting. In the JAMA study we published, they also broke it down by specialty. And it turned out that the surgical trainees actually had the most disrupted sleep. And the surgery attendings had the least amongst all the specialties. So the gap between the surgery attendings and the surgery trainees was the highest. The other fields that were very high in terms of sleep disruption and burnout were emergency medicine, and they are actually the field that I worry about the most when it comes to burnout and poor sleep, because they, like I do, work at night times and they have multiple shifts, sometimes at multiple hospitals, and I think that awareness is important.
All right, any more questions? Xiomara, anything in the chat box?
Not at the moment.
One more question. I'm sorry, I'm asking all the questions. I'm the curious knucklehead in the group. So, Dr. Gazelle, like you're having a really crazy day and 10 things are happening at the same time. And let's say somebody calls you from, like yesterday, my uncle from India called and in the middle of a work meeting. And how is it that I manage that moment? What would you suggest for me?
Thank you. So in other words, you've got a busy day, you've got all the demands, many things that you have to get done, and then this emergency comes your way, your uncle, your beloved uncle in India. Whew, I think we can all relate to, even if our relatives are not quite so far across the globe, that's scary. Sounds like it was a health issue because you'd mentioned that to me before. Yeah, so I'm assuming that you want to be at your best with your uncle, helping your uncle from afar in whatever way that you can, and also in the demands of your day. And so often, what I see in the physicians that I coach is that there's a stimulus like a call from a sick relative, and our limbic system goes into overdrive, right? Our amygdala, our fight, flight, freeze goes into overdrive, and we kind of brace and we're ready to go into action. And our emotional temperature can really shoot up. And the question, I guess, in those moments is we need to act, and yet, does that amygdala and limbic activation take us to the best and most resourceful place of action? I think many of you know that it doesn't. It can take us to a real stress response, almost like, gotta do something now. What am I gonna do? What do I need to do next? Again, fight, flight, freeze. So, what I think can be helpful in those moments, pause, take what's called a purposeful pause and push yourself to take 3 slow, deep breaths. Let some of the cortisol and the other sympathetic hormones clear out of your system. And then ask yourself, what's the right next step for me? Is the right next step to excuse myself from this important meeting and go attend to this very important family emergency? Is what's most important to not attend to it and to actually stay focused here? But it's very hard when we're in fight, flight, freeze to make that kind of important professional discernment. We all know this. We all know this state. So I wish they had taught us in medical school to simply pause. So much of medical training is don't just stand there, do something. And yet sometimes it's better to actually stand there and not do anything and take that moment for the purposeful pause. So I really want to recommend that. And we've covered that in some of the PAGNI noontime sessions, taking a pause. Thank you, Tuhina, for that question.
Sure, thank you for responding.
We have one more comment from Peter Gruber. Coggin Smith's standards show that short power naps have lapsed. Some people assuming that there is low on night shifts. Powers that don't seem to recognize this. Powers that don't seem to recognize this. My apologies.
Dr. Kim, do you want to respond to that?
Yeah, I think when I'm doing a long 24-hour shift, that there's benefit in getting naps between cases and emergencies. And I'm aware that I think the best length for a nap is something like 26 minutes. So if that can be incorporated into physician lifestyle and emergency medicine, I think that would be great. We are at the support of PAGNI and the PAGNI Health and Research Foundation. I had an experience when I was younger. I used to round with my father, who's an orthopedic surgeon, and we used to go to the physician lounges, and I could see the doctors chatting with each other, having a cup of coffee, talking about patients. And when I started working about 15 years ago here at Jacobi NCB, one thing I noticed, there was no physician lounge. So I brought that up several years ago, and we've been able to build physician lounges. We call them PAGNI physician wellness centers. So we built, I think, at Coney Island, at Harlem Hospital, North Central Bronx Hospital, and now we're in the process of finishing the one at Jacobi Medical Center. So hopefully these are places where we can embrace and celebrate mindfulness, and maybe take a 26-minute power nap if it's possible.
Well, that is a great place to end. Thank you so much, both of you. This is so helpful to all of us. I'm just going to put up the contact information for Dr. Gail and Dr. Kim, if any of you want to email them and ask them other questions. We will be sending you this presentation, so you will have all this. And to all PAGNI physicians on this Doctor's Day, thank you. Thank you for all your service throughout the year. And then there's Dr. Kim showing the sleep mask that you'll be getting, that will cook dinner for you and put your kids to bed. It's super, super, super powerful sleep mask. So thank you so much. One more time, we're going to give you the code for the CME 55ROTS. And we're sorry that it says 0.5 credit. You will get a full hour for today, so no worries about that. And then thank you. Thank you all for joining us today. We're so appreciative. And if you have a second, everyone, if you could just put your thoughts in the chat about how you enjoyed the program today, we'd certainly appreciate it. And have a wonderful rest of the week.